The dangers of cosmetic procedures being done by the wrong hands has been talked about for more than a decade. ITV News has revealed the risks of the latest beauty trend, injections to make the bum look bigger.
I had been injected with air bubbles, infection.
I feel like I've been medically abused.
I was fitting, had a heart attack. I think at this stage my lungs were collapsing, I had pneumonia.
Surgeons and politicians are saying the same thing about the aesthetics industry.
UK is the Wild West.
It's a bit of a Wild West out there.
I think it's absolutely disgusting that there are Wild West operators.
And yet today there's another report out from MPs urging the government to ban the liquid Brazilian butt lift immediately and urgently regulate the industry.
This is seen as, I don't know, beauty, it's not taken as seriously, but actually this is a £1 billion industry in the UK. You've got really skilled people working in it who are being undercut by cosmetic cowboys, and you've got consumers being hurt by this.
In September 2024, Alice Webb, mum to 5 daughters, died after having a filler Brazilian butt lift.
She was just the best mum you could possibly ask for.
Ben is the father of Alice's eldest, Delcy.
So I always feel almost a little bit guilty that I get to see, like I say, like Delcy's prom and things. I got to be there, but Alice wasn't, and I find that really difficult to sort of comprehend.
Do you think Alice should even have been able to get this procedure done?
No, it should have been banned. The government and the previous government as well, that they're well aware of the dangers and that they even acknowledge the dangers and then warn people against having the procedure done. But they haven't actually stopped it.
Last summer, the government said it would crack down on cosmetic cowboys and bring in new laws.
Cheap treatments are in fact too good to be true.
But Ashton campaigns for better practice and knows at least 85 cases where a liquid BBL has gone wrong since the government said it would act.
People who are providing them are very unscrupulous and they're making a lot of money, so they will continue to do it until the law says otherwise, which is incredibly worrying because every time we get a report in, my fear is that it's going to be another Alice Webb.
The Department of Health insisted today that it will bring in tough rules for practitioners, but couldn't tell us when they'll start the work to make that happen. Ellie Pitt, ITV News.
Joining me now is Ashton Collins from Save Face, an organisation that helps people find verified practitioners. Hello to you. Thanks for joining us this lunchtime.
Hello.
How worried are you about who's carrying out these procedures and just what the consequences can be?
We've been extremely concerned about this for a number of years now. We launched a campaign in December 2023 calling upon the government to ban these high-risk, essentially surgical procedures from the high street. We warned then that a death would occur without immediate intervention, and sadly that did happen in September 2024, and more will follow without urgent action.
It was really sad to see the death of Alice Webb, their mother of 5, aged only 33. We know also that hundreds of people have complained about these procedures. They've suffered really bad health issues because of it. I know that you've campaigned about this, that you've seen rogue practitioners being convicted because of it. What are the worst examples that you've heard about what's been going on?
Yeah, we've helped nearly 1,000 women who have had liquid BBL procedures gone wrong, and I can't overestimate how significant the impact this has had on their lives. We've had women that have literally been told that they've got a 5% chance to live. They've been rushed to hospital, been placed in induced comas, had cardiac arrest, kidney failure. We've had women who have had large parts of their buttocks surgically removed. One woman was told that she might wake up without her legs because the tissue had become so necrotic. So these are the most dangerous of procedures.
Currently, the relaxed regulations aren't there about, who's carrying this out, where they're being carried out. We're hearing stories about it taking place in garden sheds and even public toilets. Why do you think that people continue to want to have these kind of procedures? You think that social media is having an influence on this, don't you?
Social media is without doubt the biggest catalyst for why people want these procedures, and also the biggest reason that people end up falling into unsafe hands. So all of the women that we've supported saw these procedures advertised on social media as being risk-free, cheaper alternatives to their surgical counterparts. So they thought they were going for something that was a risk-free beauty treatment, not something that could end up costing them their lives.
Ashton, your register helps people find verified practitioners for treatments, doesn't it? What would your advice be for anyone considering this kind of procedure?
Always check the Safe Face register, because everybody on there is a registered healthcare professional who's passed a rigorous assessment process. And for anybody considering a liquid BBL or a liquid breast augmentation procedure, my advice would be stay clear. The risks outweigh the benefits so significantly.